You are listening to Love Your Practice with Dr. Laura Mock. I'm a general dentist, a practice owner, and a certified life coach. I teach women who own dental practices to lead with intention and literally fall in love with their businesses. Keep listening and you will see how learning to love your practice turns into loving your life too. Well, hi there, ladies. It's Dr. Laura Mock here again today to talk to you about dentistry, practice ownership, enriching your lives, helping you to have a better life, better enjoyment of your practices. And I want to introduce you just a bit to Dr. Sonia Chopra, who is an endodontist that I just interviewed, and her interview is coming up here in just a moment. She is an endodontist who teaches general dentists how to do endo. I think that's so refreshing because sometimes I feel like the specialists kind of like, keep their specialty to themselves and don't say, oh yeah, you should try that Invisalign, or you should try placing implants or whatnot. But she's a mover and a shaker and a thinker outside the box kind of person. And she really, I think, adds a nice patina to general dentistry in that she offers this amazing service. So this interview talks about her origin story, and we also delve into whether or not to sell our practices to a DSO, because hint, spoiler alert, she just sold hers, and also just a little bit about feelings and how we feel in our ownership, and how we feel about maybe selling the practice, things like that. So it covers a wide variety of things. I encourage you to listen to the very end. The entire thing is about 40 minutes. So enjoy this episode, and I will see you on the other side. Okay, I would like to welcome to the podcast Dr. Sonia Chopra.
Thank you so much for having me.
I know, I was so excited when you reached out, and I was like, let's do a podcast.
It's going to be a great conversation.
Yeah, and you and I know someone who's really amazing in common, which I think is how I became aware that you even existed, which is Ann Duffy of Dental Entrepreneur Women.
Yes, she's actually my neighbor. She lives 8 houses that way down the street.
Oh my gosh, I'm not sure I realized that part. That's so fun. I would love to have Ann be a neighbor.
Yeah, she's great. My kids and I have made her fresh bread. We have bake sales and she comes by and supports them. She's lovely.
Sure, she brings all of the woo every time she comes into your home.
She does.
Okay, so for those who are listening and are not aware, Dr. Chopra is an endodontist, right?
I sure am.
Where did you
saving teeth?
Yeah, you rescue those teeth before you have to say goodbye in the cold steel and sunshine and all that stuff. So where did you learn how to do that?
So I went to school, like I did my endodontic residency at Nova Southeastern University down in South Florida, which is a nice change because I'm basically from the Northeast. So I was really happy to get into some warm weather. And then after I graduated, I moved to Charlotte, North Carolina, and became Ann's neighbor and opened up my own practice called Ballantyne Endodontics. And that was in 2008.
2008, you opened your practice.
Yep. Because I couldn't find a job because the economy kind of slumped back then.
Yes, I remember that.
Yeah. And nobody was looking for an associate. So I could either be unemployed or I can do this on my own. And I was a general dentist for a few years in New York City. And so I was working for other people, and I realized that it just wasn't for me. And I had this big vision. And so that was my opportunity to really take the plunge.
Mm-hmm. And you just told me before we press record that you recently sold your practice, right?
I did because my path is really moving into the role of the educator, and it's taking a lot of time. And I also want to make sure I have a good balance in my life. So I have.
Yes. And after we talk about you being an educator, I want to hear about your feelings with regard to
selling, because I have so many listeners who think about selling their practices. They come to me on consults and they go, I'm pretty sure I'm going to sell it, but maybe we should coach first. You know what I mean? So we would all love to get some tea on what that's been like for you.
Yeah.
But first, I want to ask you about this educator piece because, you know, the vast majority of endodontists are technical people who like to find their little tubes, you know, and clean them out. Their space that they work in is however many millimeters deep and wide that it is. But you're doing something different that serves dentistry. So tell us about that and also how you landed there.
So I'm going to start with how I landed there because it really goes back to my childhood. I was born without 8 teeth. I was that girl who had 8 congenitally missing teeth. So I was born to be a dentist. I was always in the dental chair and I just had a lot of work to be done. And then once I started to replace those teeth, once I was getting out of that mixed dentition and into my adult dentition, my mom was very adamant about restoring my teeth before I went off to college. And right after I got bridges, because at the time it was 1995, implants weren't like huge on the scene. And so my treatment plan was getting a bridge wherever I was missing teeth. And then right after I got those bridges, I was 17 years old. I had just graduated from high school. I started developing a toothache. And I remember being at college and being in so much pain, and my dad picking me up from college to take me to the dentist back home. And I get to the dentist and I'm like, I'm dying in pain. And he looked at my tooth, he sprayed some air on it, took an x-ray and was like, I don't see anything. Nothing's wrong. And I was like, okay, well, and that happened several times, like several of those appointments where my father would pick me up from college, drive me back home 3.5 hours, take me to the dentist, and the dentist would say, nothing's wrong. And eventually I could see that I was becoming agitated to him. Like he was getting very frustrated with me. And he made me feel like I was crazy. And then eventually, because the saga went on forever, about 9 months of going in and out of this pain, and it was intermittent. It wasn't all the time. I'd have a flare up, it would go away, I would feel better. And then eventually I swelled up because I got a big cellulitis. I even got a fever because like it was just ignored for so long. And I went back home and we went to the oral surgeon because my dentist was like, well, you're just going to have to get this tooth out. And I'm like, but what tooth? Like, I don't know even where it's coming from. And he sent me to the oral surgeon to take out my tooth. I could see the hesitancy from the oral surgeon, like reading that referral slip and not really wanting to go through that. And he numbed me up because my mom was begging him because she didn't know what else to do. So she's like, please get my daughter out of pain. We all thought that was the answer. He numbed me up, took out my tooth. I was fine. And then the anesthesia wore off and I still had my toothache. So they took out the wrong tooth. So now I'm missing 9 teeth. And that hurt. Like that, I will never forget this episode in my life because it was so long and drawn out. And then finally they're like, oh, we can't take out any more teeth. We're going to refer you to the endodontist. And so finally I meet an endodontist, which I don't know why I wasn't introduced to the endodontist before the oral surgeon at my age. Because my tooth wasn't like broken down or anything. I had just cracked it. I actually cracked the tooth behind the tooth that was extracted. And then I met an endodontist who literally changed my life. Like he walked me through the whole process, like made me understand my diagnosis and why I was feeling the way I was feeling. He made me trust my body again and got me out of pain. And I was like, wow, who is that guy? Like, and he was the coolest dude. He had this like long ponytail. He was like this surfer kind of dude, like just a cool guy. But he showed me a different way. He showed me a way that I could be. And like, he wasn't frustrated with me. He was just so good with me. And I was like, I want to be that when I grow up. And medicine, yeah, medicine is always in my like bloodline because my mom's a physician, my brother's a physician. So like I knew, and I'm Indian, so I had to be a doctor. Like it was just my birthright. So I was like, I don't want to do medicine. I want to go to dentistry. And so that event in my life catapulted me to go to dental school. And then once I got to dental school, I was very interested in understanding my own particular tooth story. And then I gravitated towards endo because I realized like I could have had this root canal from the get-go and I wouldn't have had to lose my tooth.
Mhm.
And so I gave general dentistry a shot and I didn't love it. And I was like, I really want to be good at one thing. And I knew that becoming a specialist was really meant for my personality. So I went back to school, but I knew that endo was for me, and it really truly has become my passion. And I did my residency. I moved to Charlotte, North Carolina. I opened my practice. And what I have seen is that my tooth story still exists. And I would see patients come in with the same tooth story over and over and over again. And it's like, wow, so many years have passed and there's been no change, no shift in the way we learn this part of dentistry.
Mhm.
And I feel like maybe there's a reason why I had to go through that and experience that. And maybe that's my signal to start this mission of really helping dentists fully understand and fully embody and embrace endo as a critical part of dentistry and building their practice. And when I do this, I know that my reach on people and how I impact people and, you know, as a whole is going to be even bigger. So that's how eSchool came about.
It's called eSchool.
Yeah, eSchool, everyday endo made easy. Yep.
Okay. And who do you teach? Tell me more about what eSchool does.
So eSchool is directed towards general dentists. Like that is my target audience because they need to understand endo from like a cellular level because patients are seeing them first before they're getting referred to the endodontist. So even if it's just simple diagnosis and you don't want to do endo, it's still such a powerful program because you're going to make sure that you are diagnosing your patient the right way first. I mean, look at my story, right? And if I can prevent that, that would be amazing. So we only get 2 weeks of endo in 4 years of dental school. And then we only have to do, well, when I graduated, it was 4 root canals. Now I'm hearing some schools only have to do 4 canals, which equates to 1 tooth. So the amount of endo education that we get in dental school is not enough.
Yeah.
And I feel like nowadays with the transition into more corporate dentistry, associates are kind of required to know endo. It almost makes you a more valuable player if you understand endo and if you can do endo better to unfortunately keep the numbers up. And I just don't think we get enough of it. So this is my way of giving back to dentistry to really create a program that is comprehensive with endo and also delivers information in a really kind and loving way. Because people can't ask their endodontist for help because there's going to be that kind of battle for competition. And I will say some of these Facebook groups in dentistry are lethal and they're it's not a really safe space to learn. So when I say that it is a kind, loving, and supportive community and environment, I really mean it. And I think that's probably one of my favorite parts about the whole program is that, again, it's a different way to learn.
Okay, I have comments. This is so amazing. Like, first of all, I do feel like I went to Iowa and they drilled into us the diagnoses, the different categories, and we had tests and what's this one, what's that one. Of course, I don't know if I could tell you now, but I feel like they taught us just enough endo. The ortho department did this too. They taught us just enough that they're like, basically you should refer all of these, you know what I mean? And so then there's this hesitancy to offer it at all, which can hurt a private practice, especially one, like many of my listeners are either on their way out or they're out of insurance dependence, if that makes sense. And so being able to offer that variety of care is beneficial to both the patient and the practice if they can offer endo in their own practice. Do you find that there's a culture of encouraging general dentists not to learn endo?
So is there a culture to almost like, the culture that's created in endo is kind of weird. It's almost like they teach us enough to say, okay, go out and do it, but then they don't teach us enough to be confident in doing it.
Mm-hmm.
Whereas I feel like ortho is taught a little bit differently. I feel like they really don't teach it.
Yeah.
Right?
Yes.
But here is the problem. Endo shows up in so many different ways in your practice that you have to teach it. I almost feel like there should be a requirement, a clinical requirement, almost like a fellowship for people who want to really perform it in their practice. But you can't forget about diagnosis. So, and here's a perfect example. When people tell me, oh, I don't need to learn endo because I don't do any endo in my practice and I do refer it out, I say, okay, here's the problem. If you aren't even cold testing, I actually have had so many of my students say they don't even have endo ice in their practice, or they weren't even taught how to cold test in dental school, which is a problem because just because you see a radiolucency on the radiograph doesn't mean that that radiolucency is an endodontic problem. So when you are just treating the radiograph and you send your patient out to the endodontist, hey, do endo here, and we do the cold test and we see that the tooth is vital and there's a pretty big lesion, and that could probably be something like OKC and actually need to go to the oral surgeon. Now we have a problem. And now this is going to impact the business of your practice because you have a patient who spends almost $500 on a consult. Okay. They get a consult, they get a cone beam, they get a radiograph, and they get time with the doctor. And we diagnose it and like, oh, okay, this is not an endo problem. We need to send you to the oral surgeon. Mm-hmm. Now they just spent $500 to be told they need to go to the oral surgeon. Now the patient's upset because, well, why didn't my dentist just send me there? Becomes the dialogue. And we have to make something up, right? Oh, because, I have this special technology that can see more, right? Maybe they don't have the cone beam. So I can use that as an out. But those conversations are getting harder and harder to have. So what do I see as the problem there? Well, number one, we could have saved that patient money. Okay. And I really want to save patients money. And if by just doing a simple cold test, they can land in the right provider's chair. So even if you're not doing a lot of these specialty procedures, you got to get your patient in the right seat. Mm-hmm. Now that's $500 less that patient can spend in your practice, right? Which is another problem. You're taking away from yourself and the patient. So endo is so important with diagnosis. Endo is important with understanding pain management. Endo is important with understanding cracked teeth and vertical root fractures, trauma, resorption, internal bleaching, MTA vital pulp therapy. There are so many things that I haven't even picked up a rotary handpiece.
Yeah.
So it is the responsibility of dental schools to really make endo a big part of the curriculum, because I don't know if you just saw that, but there's a constant thread of endo through every specialty in dentistry, yet we are not emphasizing it enough. Mm-hmm. And that culture, unfortunately, I don't see changing, but we're also teaching it in a way because really the only CE out there are all these companies who want to sell their product. And so they're teaching you 30-minute endo, 1 hour molar endo, and boom, 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 when we're not really focusing on the quality of care that we need to give to the patient. And then 50% of the patients I see in my practice are redoing root canals that weren't great. And
Right.
that's really unfair to the patient. So anyway, I think learning endo could prevent negative Google reviews, unhappy patients. It could actually empower your patients. It can actually grow your practice. I think there's so many different hidden ROIs that maybe people aren't thinking of.
That's really fascinating. Now, okay, so pretend I am a listener and I'm like, okay, I hear this. I can see the benefit of learning this better than what the school taught me. Can you describe what it's like for someone taking e-school? Like, do they go and see you in person? Or is it
Yeah.
all online? Do we get practice finding the MB2? Dig
Yeah.
me down.
So it's all the things. So there are three primary iterations of eSchool. eSchool originated with having an online program. Okay. And then I launched this before COVID. So I almost had some foresight as to what was happening, right? So it's an online program. This is the base program, in my opinion, which is accompanied by coaching calls with me. So much like we're talking today on Zoom, we would have Zoom coaching calls because it's one thing to digest the recorded content, right? And you're always going to have questions. So that's where the coaching calls come in because I can give you the clarity that you're really looking for on those coaching calls. And we learn within community, which is even better because you don't feel alone when you have a question that you may think is stupid, but actually it's not because everybody else has the same question. So it's almost like comforting when somebody has a question and you had it and you didn't really speak up. So it makes people feel good. And that's an 8 to 10 week program. It really depends on my schedule and if I give people some implementation weeks and whatnot. So it's about an 8 to 10 week program. And that really gets you good. Now, obviously, there's some people that they don't really want the coaching calls. They do better with just DIY, doing it themselves, and they can take their own accountability in their own hands, and they just want to digest the content. And so you can do it independently and that you just buy it and do it on your own. You don't really need access to me. I think where the benefit is when people have access to me. And then through listening to my doctors, I've learned that some people are real hands-on learners. So I actually created a program called eSchool Live, which is a hands-on program, but it's on live patients. It's not on extracted teeth because extracted teeth does not correlate to real life. So I love this program because it's a dual purpose program. It is a community give back because the patients come in and they get a root canal and a buildup for $100. And then the doctor gets to work on them all under my supervision. So people aren't coming to me to watch me do root canal because what good is that? You're coming to me in my practice. And this is, even though I'm in North Carolina, it's actually open to anyone, any dentist, as long as there's one little stipulation we work through with the malpractice, but it's pretty easy. And you bring your dental assistant and you work together and I watch you implement all the things that you learned in the online. So the online with coaching is actually a prerequisite for that live because I don't have time to teach you. It's a 4-day program. I don't have time to teach you the like tips and tricks and then you implement. You have to go through that process and then you come in for big impact. You already know the things and now we're going to put those things into action. Mm-hmm. And you do 4 root canals, which if you think about it is more than you did in 4 years of dental school, but you do it with a practicing endodontist who has a ton of efficiencies that they want to teach you to reduce your chair time. Like I give away all my tips and tricks, every single one of them. And then every like template download, whatever, like it's like a copy paste. It's like as fast as you can get to the end result as possible. And you also get to play with all my fun gadgets and you get to see the whole process and it's really beautiful. And what I see through eSchool Live is a full-on transformation. How people come in on Friday is a completely different doctor than how they leave on Monday. Mm-hmm. So
I can imagine because I mean, for me, after a couple of endos that didn't go well, I just was like, no, I'm not doing this anymore. So I would be coming in like all meek and apologetic.
It's great because I can customize it for the doctor. So I only take 5 people at a time for the live, so I can really keep it small group and like high touch. And everyone's different. Some people are like, nope, I really want to master the maxillary first molar. And, I can, through the coaching process, I can see where, okay, yeah, that's what you need. That's what you think you need sometimes, but I'm going to gradually get you up there. And then other people come in really timid and scared, and they need to start a little easier. So it's easy for me to customize the patients for each doctor so that you can get the level that you're looking for.
Mhm. That's amazing. So how do women find you? And I'm not sorry, women. I'm thinking about my own. I'm like, oh, there's men dentists too. Oh, sorry.
Yeah. Yeah.
How do your students find you?
So a lot of people find me on Instagram at Sonia Chopra DDS. And that's Sonia with an I. And then I have a website too, which has all this information, and that's soniachopradds.com.
Okay. Well, that's good. We'll put that in the show notes because there may be listeners who want to take your e-school.
Yeah.
You have to start with the online part, and then they can come to Charlotte, which is easy for almost everybody to get to.
Yeah.
As long as you're willing to fly American, right?
Exactly.
Because that's the American hub. But I love going to Charlotte. It's such a great city to visit. And so they can do that after they go to e-school.
Yep.
Do you have anything else that you offer you want to mention before we talk about other stuff?
Well, things are coming into motion. I am starting a new little coaching program myself, mainly for endodontists, to help them really love their practice. I'll take it back to you. Because I have learned to be super productive. I have 3 kids. I have a pretty successful practice, and then I have now this new entity of e-school. And so I knew at one point in my life I was going to have to give something up at my practice, but letting go of my production was hard for me to digest. And so I've learned to become very efficient at the practice, and I make the same amount of money that I did in 5 days a week. I can do now in 5 days a month.
5 days a month. Wow. Yes. That's amazing.
So that's been incredible for me. And now I help other endodontists do that. But I've realized that it doesn't have to just be endodontists now. I'm realizing it can be general dentists as well. Because I do believe that when we free up some of our time and we're still making that same amount of money, now all of a sudden we can take care of ourselves better. So.
Yes, for sure. Especially with such a physical, and emotional job that we have. We can't do that 5 days a week and take good care of ourselves and our patients.
Yeah. I don't think people realize just how much energy we take in a day. It's not just, I have always thought that it was a physically tiring profession, but now that I'm through it a little bit more, and I realize, I'm like, no, it's actually energy of patients. Like when they're pissed off, they have to pay over $1,000 for a root canal, or pissed off, they're in pain, didn't sleep. And then they're terrified and in my chair, and I'm feeling their energy, and I'm actually absorbing all of that, and I take it home. And that's actually what's exhausting. And then throw in all the team stuff and the drama and that. And you go home and you're just like, oh.
Yes, for sure. And what you're talking about, human emotions are very contagious. Like we see somebody else's nonverbals and we hear their tone and we take that in. So if they're pissed, we start to feel a little pissed. If they're nervous, we're nervous that we're going to hurt them. It's very contagious. And so even learning how to deal with that takes a tremendous amount of energy. And even when you're really good at it, it's still going to be something that makes you tired at the end of the day. And then that makes it harder to take care of your family and yourself and all that stuff. That's amazing. 5 days a month. I'm really proud of myself because I work 3 days a week, but you got me beat.
I actually think if you don't have a side hustle, I think that 3 days is the secret spot. I really do. I think anything more than that, you'll see that dentistry wears you out, because for some reason, it's full of emotions when it comes to people. People have these weird emotions. Like, I don't have the same emotion to my gynecologist. Like, it just doesn't exist. Yet I don't want to really go to that appointment, but I still don't verbalize that. But people verbalize that towards us. It's
They
the
do.
strangest thing.
They say things like, I'm here, but I hate you.
Yes.
And
I'm
they
like,
think that
oh,
it's normal to say that.
right. Like, but they really don't. When you actually talk to a person and say, you do realize what you just said, right? Then they think about it like, oh my gosh, because it's just a part of our culture now. And it's time to change that culture, and it's time to change that narrative
Yeah.
for sure.
But then going back to the emotional energy of in that 3-day work week, which I agree with, 3 is so good. By the time I
It's the
get to
sweet
Wednesday
spot.
afternoon, I'm tired. But not only that, but I mean, our listeners today, they're also carrying the emotional burden of being owners.
Yeah.
And it's so amazing to be an owner. It's so empowering and great, but it's also terrible.
Yes, I agreed.
Yeah, and tiring, and you need time to let your brain rest so that you can work on your practice
Right.
and not just in it. And so I support that 3-day week, and I agree with you that being a dentist is emotionally and physically draining.
Yes,
Mhm.
agreed.
So that brings me to that news that you told me that you sold your practice.
I did. And I want to be clear. I didn't sell my practice because I couldn't manage it. Like, my practice is such a beautiful, well-oiled machine. In fact, I feel like it ran a little bit better back then. But that wasn't my why. My why was because I have so many other things going on that it just made sense, especially since, like, I sign a contract, I have to be on that contract for 5 years, and I'm a very futuristic thinker. And so I knew that in 5 years, my life is going to look different.
Yeah.
And I knew that it was time to say goodbye. It might have been a year or two early, but something was telling me that it was the right time. But it has been a hard transition for me.
So I want to ask you about why it's been hard, because I already know that sometimes ladies, they come to me and they're like, I think I'm going to sell. I want to sell it. I don't want to deal with this anymore. So I just want you to talk to me about what's hard about selling it so that the ladies can hear it too and plug it into their decision-making matrix.
Okay, I'm going to be like painfully honest. So step one is, when you say you want to sell, do you really know why you want to sell? That is the question. Is it because you don't enjoy the day to day? Like, do you have another thing you can do? Because if you sell, you should also think about what's your exit strategy in case after the sale it doesn't go right. Think about that. And so if you are still hanging on to dentistry to be your thing, think about, if everything goes bad, do you really want to sell? Could you imagine yourself opening up another practice and going through, or would you be willing to actually fix what you currently have? And everything is fixable and everything is figure outable. So my suggestion is, if you don't want to deal with the day to day, that's not the right thing to do. Because after you sell, you're still probably going to be on a contract, because that DSO is going to want you there. They don't want to have to find another dentist. You're their goal. So you're just going to have more people telling you what to do and what not to do and how to do things. And if you're a freedom lover like myself, you're going to have issues. So but that's a me problem. My DSO is great. I'm not trying to like bash anybody here. My issues that I'm having currently are things that I knew that I was going to go through, that I expected, because my practice was my first baby. I started my practice before I had my 3 children. I have really put so much time, love, and energy into this space, because I know I'm going to be at that place more than I am at home. And I've really taken great care of it.
Okay, wait, I have a follow-up question.
Yeah.
What is hard as a freedom lover, as you called yourself, what is hard about then handing your practice ownership over to a DSO as a freedom lover? Why is that hard?
Because that's not me making the decisions anymore.
And you liked that.
Of course. And I could be quick about it. Now I got to go ask, and I say this with all the respect in the world, mom and dad. I call them my mom and dad because I have to go and ask mom and dad. And that is hard for me. And that is just because of my personality. It's not a thing for them. That is just a thing for me. And so I ask people, like, if you are really considering this, do you really feel like you can do that? Or do you enjoy making the decisions?
Mm-hmm.
Or instead, what are you looking for? Are you looking for maybe empowering a team that can help take stuff off your plate? Is that the real symptom here? Or do you really just want to outright sell and you're okay working under somebody else? Like that, I think that's the real like conversation you need to have with yourself.
Yeah, that's a perfect question for all of these listeners to ask as they're fantasizing about selling. And
Yeah,
the sunset is this okay? Can you have a mom and dad in charge of your practice?
yeah, because you will have to ask them for approval. And if you want a new piece of technology, you have to get it approved. You know, some people say that, oh, we don't mess with your day to day. I'm not really sure that's true.
Okay.
You know, for the most part, my practice runs pretty much for the same way it did, right? So I'm still managing my team. I'm still dealing with all the things. Maybe I gave away payroll, but how hard is payroll? Let's be real. It's not that hard. You just call up, then you give them some hours, or you have a team member do that. You're not even doing that. So it's not really anything coming off your plate. So the reality is selling to a DSO takes nothing off your plate.
Okay.
Okay. Is that
yes,
easy?
that's a
Because
key point right there.
they're not in your office trying to manage it for you. What you really want is somebody to manage it for you.
Yeah.
But you just have to get better at delegating yourself, which I didn't have that problem. Like I said, I have an awesome team and they do so much for me. If I lost my team, now I'd be screwed. Right. But then I would just exit dentistry. Like that would be the point where I exit dentistry. It wouldn't be selling to the DSO. I would leave. But yeah, so I think I think the choice is very specific to each individual. And for me, it felt like the right time because of the trajectory of where my life was going as an educator. And I'll probably still stick around even after my contract is up. I probably, because I really love doing what I'm doing. And for the most part, my DSO has been awesome. Like I can't really say anything bad, but I can't forget about the emotions that I'm having, which I knew I was going to have, that my baby is a little bit different.
Yeah.
And I think that's okay.
What is the name of that emotion when you think my baby's a little different now? What's the name of that?
Oh, that's a good question. I don't know. It's probably the same feeling I'm going to get when my kids go to college. I don't know if I can name it yet. It's like your baby's there. They're just a little different. And it's an evolution. It's a part of the evolution.
Yeah. So it might be like sentimental or just sad.
There is a bit of sadness for me. I'm not going to lie. And I think it's okay for me to be truthful and transparent and honest about it.
Oh, I agree. And, we talk about this, especially with my clients, but when you're feeling a hard emotion, it's really, really helpful to name it and describe it in your body. And the reason that it's helpful is because evolutionarily speaking, your body wants you to feel your emotion. It wants you to acknowledge it so that you know how your body wants you to act.
Yeah.
So when you acknowledge it, you're like, I feel sad. And the sadness feels like a heaviness in my body, or I feel pressure behind my eyes because I feel a little bit like maybe there's going to be some water coming out of my eyes, then it just kind of helps it to pass
Yeah.
when it's
And-
time. It's not instant.
Right. And so I'm having grace with myself and my emotions, and like I'm feeling it,
Mhm.
and I'm honoring it, and I think it's okay to feel this way.
I agree.
And it's just like it's a different part of my life. Like I'm seeing, I don't know, maybe I'm sad because I'm getting old. I'm getting older, things are changing. My parents are changing. The periodontist who used to work in my building moved buildings, and that was sad. Like it just seems like it's a lot of change, and I'm just noticing it.
Yeah. And I imagine since the timeline you gave me that your children are reaching an age where they're a little bit more independent than they used to be.
Yeah.
Mhm.
I don't have to wipe
Their
their
own
butt
thing.
anymore. It's sad. I don't have to wipe their butt anymore.
Yeah, they
So
wipe their
sad.
own butt now.
Yeah.
They don't need you to do that.
I know. So there's just a lot of change. It's crazy.
Yeah. Well, thank you so much for your vulnerability and sharing that, because we all as women and owners and dentists, we have so many feelings, and a lot of times we're embarrassed that we have those feelings, even though they belong there in our bodies. Our bodies have DNA that dictates that we will feel emotions, but at the same time, we put on these happy faces and we're like, we're great, we're busy, everything is
Yeah.
fine, and we
Yeah.
smile and let our dimples show or whatever, but we might have some sadness inside of us and we don't realize that it's okay and natural to feel that. So thank you for sharing.
Yeah. You're welcome.
Yeah. And I look forward to meeting you in person in just a
know.
couple of weeks at the Dental Entrepreneur Women's Annual Retreat.
It's going to be a great time. I can't wait.
Yeah. And for those listeners, again, this is Dr. Sonia Chopra, and we're going to have how to find her contact information on my website, which is loveyourpractice.net. I just want to thank you again for your time. This has been a beautiful discussion, especially this vulnerability at the end. It really is a gift. Thank you so much.
You're welcome. Thank you.
Thank you for listening to Love Your Practice with Dr. Laura Mock. I would love to meet you. To join our movement, find the Facebook group called Love Your Practice and request to join. If you can't find it, just send me a message and I'll add ya. You'll find me there helping all of my ladies to fall in love with their businesses and have a better life.